All right, we'll come in, perform hand hygiene. Hey, my name's Anna. I'll be your student nurse today. Can you tell me your name and date of birth?
Kyle Acreman, 6487.
Can I check your wristband? All right, that matches. So I'm going to perform your head to toe assessment today. Is that okay with you?
Yes, ma'am.
All right, do you have any allergies?
I do not.
All right, any latex, food, medicines, nothing?
No, ma'am.
Okay. Are you in any pain?
No, ma'am.
Do you need to use the bathroom?
I do not.
All right. So, can you tell me where you are right now?
I'm at our house.
Do you know what room you are in our house?
The living room.
All right. And do you know what who the current president is?
Donald Trump.
Okay. So you are oriented times 4. So I checked that. And then when he came in, I checked his physical appearance and his body stature, his mobility, and his behavior, which is all normal for age. And he does not seem to have like low self-esteem, anything like that. So I'm going to go ahead and start with your head, okay? So I'm going to palpate your temporal pulse.
Mm-hmm.
Okay. Then I'm going to check your head. You do not have any thinning of your hair. Do you have any pain while I'm messing with your hair?
No, ma'am.
All right. You do not have any lesions on your head. Any issues like that? All right. So I'm going to start checking your cranial nerves. Okay. So the first one is your olfactory nerve, and that is smell. So I'm going to have you close your eyes and smell something familiar.
All right.
And you let me know if you know what it is.
Can we do that again?
Mm-hmm.
Hand sanitizer.
Okay. That's good. You can open your eyes. Okay. So your second cranial nerve is your optic nerve. So I'm going to get my pen light and shine it into your eyes. All right. So look straight ahead. Okay. Your pupils are 4 millimeters, which is normal. I'll give you a minute and then I'm going to check your accommodation. All right. You ready?
Mm-hmm.
Okay. Okay. So accommodation is shining light in this eye and checking this eye to react the same. So for 3, 4, and 6, we check those together. And that is going to be, I'm going to have you look straight ahead. And I only want you to follow me with your eyes, not with your head. Okay? So we're going to go ahead and start. So don't move your head during this, just your eyes. All right, put your head up a little bit. All right, follow me with your eyes. Okay. All right. So that was fine. So for 5, we're going to check your trigeminal nerve. So I'm going to have you clench your teeth. Do you have any pain?
No, ma'am.
All right. Your trigeminal nerve is up here. So if you didn't have pain up here, that's good. We already did 6. So 7 is your facial nerve. So I'm going to have, can you smile? Can you frown? Can you puff your cheeks? Can you move your eyebrows up and down? All right, good. Okay. So your 8th nerve, is your acoustic nerve. So as I checked your chart earlier and saw you had spinal meningitis when you were 2,
Mm-hmm.
so you were completely deaf in the left ear. Is that correct?
That is correct.
All right, so we're going to do this on the right side and see if you can repeat what I say when I whisper it to you, okay?
All right. 1, 2, 3.
Okay. So for 9 and 10, that's your vagus and your glossopharyngeal cranial nerves. So can you say light, sight, and dynamite?
Light, sight, and dynamite.
All right, so I'm also going to check, can you stick your tongue out and move it side to side? Okay, and I'm going to check your uvula. So stick your tongue out and say ah. And you still have your tonsils, but they're not touching and everything is good. So for your 11th cranial nerve,
Excuse me.
I'm going to check your spinal accessory. So I'm going to push on your shoulders, and I want you to raise your shoulders up. Okay? All right, while I'm back here, I'm going to check your carotid arteries. I'm going to check one at a time so you don't pass out. Okay. And then I'm going to auscultate for breath. also going to check your thyroid gland. I'm going to displace it a little bit to the left. You have any pain?
No, ma'am.
All right. Nothing's abnormal, but I'm going to auscultate for bruise. Okay. All right. So no issues there. No pain?
No, ma'am.
All right. So I'm going to go ahead and check your lymph nodes.
Mm-hmm.
So we're going to do preauricle. And if they're swollen, we know you have an issue, or you could have an issue. Posterior auricle, occipital, submental, submandibular, posterior cervical, superficial cervical, and then supraclavicular. Any issues with that?
No, ma'am.
All right, I'm going to go ahead and check your skin turgor on your clavicle. Everything's normal, no dehydration. All right, I'm going to listen to your breath sounds. All right, just sit straight up for me. Okay, so I'm going to listen to you breathe. This is your bronchial, and it's high-pitched. It's your bronchiovesicular, which is moderate-pitched. Your vesicular, which is low-pitched. I'm going to do the same on your back. All right. Bronchial, take a deep breath. High-pitched. Deep breath. Bronchiovesicular, which is moderate-pitched. And vesicular, which is low pitch. One more time. And last time. All right. All that is good. All right, so I'm going to go ahead and listen to your heart sounds.
Mm-hmm.
I got to do it with the bell and the diaphragm, so it'll take a few minutes.
Mm-hmm.
All right, you can sit back in the chair. All right. So we're going to do your aortic, which is in your second intercostal space. We're going to do pulmonic, also in your second intercostal space. We'll do Erb's point, your third intercostal space. We'll do tricuspid, fourth intercostal space. Oh, sorry. And we'll do the mitral, your fifth. And then we'll do your apical pulse, which is right under your nipple line. Okay. And S1 is heard best at the apex of your heart. S2 is heard best at the base. Okay?
Yeah.
So I'm going to go ahead and move from that, and I'm going to start on your upper extremities. So if you put both your hands out for me, we're checking for any tremors. You don't have any tremors, any edema. You don't have any edema. Okay, your skin, again, cool, dry, no lesions. All right, I'm going to check your brachial pulse and your radial pulse. Should be the same on both sides, but we'll check. Brachial pulse and your radial pulse. Okay, so we've got all that done. So we're going to do your abdomen. So we'll have to go lay down for me to do your abdomen, okay?
All right.
Okay. So to do your abdomen, we have to auscultate first because we don't want any false bowel sounds.
All right.
So I'm going to check your skin out. cool, dry, no lesions. All right, so we're going to start with your right lower quadrant. Okay, I'm going to palpate for bladder distension. All right, then I'm going to palpate. Do you have any tenderness or pain?
No, ma'am.
Okay, so everything is good with that. And so we also checked his genitalia, and his urethra is centered like it should be. He does not have any lesions, and his hair is normal, no thinning or anything like that. So we will go back up here to the chair to do his lower extremities. Come on. All right, for your lower extremities, can you stick your legs out for me? Okay, no tremors, check for edema. While we're doing this, we're looking at his skin. His legs are cool, dry, and no lesions. All right, so he does not have any tremors. We'll go ahead and check the clubbing. He does not have any clubbing, and his capillary refill is less than 3 seconds. Do the same thing on his hands. His capillary refill is less than 3 seconds, and no clubbing. So we'll go ahead and, when we were checking his genitalia, we checked his inguinal lymph nodes, which are in his groin, and then his femoral pulse, which is in the groin area as well. So I'm going to go ahead and check the pulses in your feet.
Mm-hmm.
So we'll do your dorsalis pedis in your foot, which is +1, and your posterior tibial, which is +1. Go to the other side. Dorsalis pedis and your posterior tibial. Okay. Do you have any pain or any issues?
No, ma'am.
All right. Before we leave, can you grab my hands and squeeze to check your muscle strength?
Yep.
Any issues with that?
No, ma'am.
All right. So I'm going to perform hand hygiene. Wash my hands. And before I leave, I'm going to make sure the side rails are up ×2. The bed is low and locked. And you have your call light. And you let me know if you need anything.
I will do it.
All
Thank
right.
you very much, ma'am.
Mm-hmm.